Namaskar. Om 𝐚𝐼𝐴 Namaha. Om Manjunathaaya Namaha. Myself, Professor P. Hemant Kumar, Head of the Department of Shalyatantra, Surgery, National Institute of Ayurveda, deemed to be University, Ministry of Ayush, Jaipur. On the occasion of 9th National Ayurveda Day, we are celebrating this year on 29th of this month, October. The main objective of National Ayurveda Day for 24-25 is promote the integration of Ayurveda into mainstream healthcare through startup innovation, encourage research-driven startups that blend ancient Ayurvedic knowledge with modern technologies. This Ayurveda Day usually we are celebrating the birthday of Lord Dhanvantari, that is Dhantarasi, before Diwali. On this occasion, I am going to present management of Dushtavarana, reference to non-healing wounds. Before going to present this talk, I introduce my department. Our department has a various specialities and facilities in our department, like OPD, general surgery OPD, anorectal OPD, orthopedic and marma chikitsa OPD, and we have a excellent infrastructure of operation theatre with full-fledged all general surgeries, orthopedic surgeries, laparoscopic procedures, laser surgeries, major surgical procedures, minor surgical procedures we are performing in our operation theatre, and especially we have a special parasurgical procedures like leech therapy or Agni Karma, dermal cautery, Kshara Karma and Kshara Sutra. These are the different procedures we are performing in our department. See, coming to the talk, see, Dushtavarana is one of the commonest diseases we are facing in present scenario. Like commonly we have seen this Dushtavarana seen in the diabetic foot ulcers, arterial ulcers, Burgess disease and other venous ulcers, etc. We have seen this type of Dushtavarana. See, then coming to talk, what is Vrana? So, this is most important. See, Vrana is nothing, Vrana Gatra Vichurna, Vrana Yatiti Vranaha. That means, Gatra means the body tissue or part of the body, Vichurnana means destruction, break, rupture and discontinuity of body tissue. The destruction, break, rupture, discontinuity of the body tissue are called Vrana. See, the wound healing procedures described by Susruta in Ayurveda still holds its place today. The faster the wound healing, the faster is the recovery of the patient, enabling him to resume his daily routine. Various purification therapies like Sodhana, Ropana, procedures mentioned by Susruta, it heals faster the wound without any sepsis. See, Dushtavarana is one of the variety of Vrana, like two types of Vrana, that is Nijavrana and Agantachavarana, that is traumatic and non-traumatic wounds, and out of this there are different infected wounds or non-healing wounds or comes under this Vrana, that is called as a Dushtavarana. And commonly the prevalence rate of this Dushtavarana, especially diabetic foot infections over the global, 10% of the total Indian hospital admissions are suffering with non-healing ulcers, that is Dushtavarana. And Dushtavarana is the common and frequently encountered pattern problem faced in surgical practice. Coming to treatment, there are different types of modalities mentioned by Susruta in Ayurvedic classics, like Saptavida Upakramas and Sashti Upakrama. The main general principles of management of non-healing ulcers or wounds include Sodhana, Samana and Ropana. Sodhana is nothing as Abhyantara Sodhana and Bahya Sodhana. Abhyantara Sodhana means Vamana, Virechana, Siro Virechana, Vasti, etc. Bahya Sodhana means Rakta Mokshana, Varna Prakshalana, Varna Pichu, Varna Lepa. See, Rakta Mokshana especially we are practicing non-healing ulcers, especially leech therapy, 𝐾𝐞𝐦𝐚𝐧𝐭 𝐚. This is one of the important modality of parasurgical procedure. We are widely used the involvement of Rakta and Pitta dosha, especially we can see in venous ulcers and especially we can see in the Burgess disease and arterial ulcers or diabetic foot ulcers, we can treat with the leech therapy. And another modality of Bahya Sodhana is Vrana Parisheka. You can wound washing with any doshaharakvadas like Trifalakvada or Panchavalkalkvada or Varunadikvada, etc. We can, or Aragvadadikvada, we can use on the external wounds for the cleansing of the wound like Surasadhiganakvada, Aragvadadikvada, Trifalakvada, etc. Then Alepa, there are some of the external applications also mentioned by classics like Nimbalepa, Tilakalkadilepa, Dashangalepa, Haridra Lepa. This is also helpful for the wound cleaning and also for the healing. And wound debridement, mainly there are three types. One is called surgical debridement, number 2 is mechanical debridement, number 3 is a chemical debridement. Surgical debridement is nothing as a, if you have a slough is there, if any gangrenous foot is there, we can go for Chedana, Bedana, Vishravana, Lekana, like that. We can exercise the slough tissue for encouraging for wound healing with the help of using Vrana Sodhana and Vrana Ropana drugs. And mechanical debridement we can use with Parisheka. We can go for sprinkling of some Kvadas. Already we discussed Aragvadadikvada, Panchavalkalkvada, we can go for Parisheka. And number 3 variety is called as a chemical debridement. We can use some of the non-healing ulcers use of Pratisarniya Kshara, external application of Kshara. See, these are the 3 important debridement methods mentioned by Ayurvedic classics. And Samana Chikitsa, especially we can use internal medications also. And everybody knows about this Amlaki Rasayana. Amlaki Rasayana is the best wound healing. It rich of vitamin C for the encouraging of the wound healing. Like Haritiki Churna, Amapachanavati, Trifala Gugulu, Panchatikta Gugulu, Nimbadivati, Vidanga Churna. These are the different Samana Chikitsa drugs we are using in normal practice. And Ropana drugs, this is very important. Ropana to encourage the healing of the wound comes to the normal tissue with a normal color with the help of Jatyadi Taila, Yashtimadu Taila, Samangadi Taila, Durvadi Taila, Durvadi Gruta, Priyangadi Taila, like so many other Vrana Ropana preparations are available in the classics for encouraging of the wound healing. See, some of the research works I conducted in my practice for last 26 years. So just I am enlightening my research works on Dushtavarana. See, before research work, this is very important to consider the scientific parameters like subjective parameters and objective parameters. Like subjective parameters like pain and objective parameters like tenderness, wound mapping, Gandha, Varna, Srava, granulation tissue, antimicrobial studies and photographs before and after treatment. You must to go for this criteria before research work. And there is a conventional scoring system also we adopted in the scientific study. Like Bates and Jensen wound assessment tool, there are 13 parameters are available like size, depth, edge, undermining, necrotic tissue type, etc. We can go for the proper assessment and scientific tools we can use in the research works. And there is a available market, there is a Verge video meter or stereo photogrammometer. This is very important to take the photographs before and after treatment with 3-dimensional photograph. You can assess the length, breadth and depth of the wound. And wound mapping also is very important before, during and after treatment of wound with our Ayurvedic preparations. And one of the study we conducted, that is the Sodhana effect of Karavira, the Rasakriya in Dushtavarana along with antimicrobial activity. See, this is a very important drug, acts as a Vrana Sodhana and also for Vrana Ropana. We conducted in bacteriological study on Staphylococcus species, Enterococcus species, E. coli and Proteus species it is a wonderful effective on those species like Staphylococcus and Enterococcus. And it contains like Karavira, Chitraka, Pata, Vidanga, Haritaki, Haridra, Daru Haridra, etc. drugs are using for Rasakriya. And these are the some of the pictures are before, during and after application of Karavira, the Rasakriya. There is another study conducted under me, 𝐽𝒌𝐿𝒂𝒂𝒓𝒔𝒉𝒂𝒏 𝑽𝒊𝒓𝒕𝒖𝒂𝒍 therapy that means leech therapy along with other Vranasodhana and Vranaropana drugs we can use for the better results in reducing the burning sensation, itching and discharge in non-healing ulcer. And there is another study conducted, 𝐽𝒌𝒂𝒂𝒓𝒔𝒉𝒂𝒏 and Sodhana Ropana Lepa in Dushtavarana. It is also very encouraging results with more effective in by reducing discharge, odor, minimizing wound surface with leech therapy. And effect of Arkadigana on gram-negative bacteria also used for especially for the E. coli and Proteus mirabilis. Those gram-negative bacteria were treating with Arkadigana. See, these are the pictures of before, during and after treatment of Arkadigana. And also we conducted leech therapy in Burgess disease, especially thromboangiitis obliterans, that is arterial ulcer, we treat with leech therapy. And there is another study we conducted in Patoladikwada and Kampillakadi Taila in the management of Vrana. And there is another very important work on Madhumeha Javana, diabetic foot ulcers with Durvadi Gruta. These are the photo pictures of before, during and after treatment of Durvadi Gruta. And very important is internal administration, that is Abhyantara Sodhana with Virechana Karma. This is also very helpful for wound healing, especially for non-healing ulcers we can go for managing with Virechana Karma. And there is another study we conducted with Tilakalkadi Lepa in the management of Tridoshija Dushtavarana. These are the some of the photographs before, during and after treatment. And another study we conducted Panchavalkalakwada Prakshalana in the management of Dushtavarana. These are the some of the photographs before, during and after treatment. And there is another condition in Dushtavarana, we can use Varana Basti and especially for foot ulcers, we can use this Varana Basti with Jatyadi Taila. And Kasisa the Avachurana, there is some powder also we used in the application of Dushtavarana. And some of the photographs we are showing for the effect of before, during and after treatment of Jatyadi Gruta. There is another study we conducted, Fournier's gangrene. This is a very important disease. Immediately can treat this disease. Why? Because there is a chances of septicemia. See, by this we can use excision followed by the application of Panchavalkalkwada and Jatyadi Gruta and followed the Sandhana Karma, that is scrotoplasty. See, this is the reconstructive procedure and we reconstruct the scrotal skin. These are the some of the studies we conducted under my guidance. And magotification also we are practicing before, especially in the tumors like Nishpava, Pinyaka, Kulutta, Mamsa, Takra. We are treated in before condition of any huge cancers, especially non-operable cancers, like I am giving one the example of magotification before CA breast followed by the radical mastectomy and skin grafting. And recurrent post-operative case of chordoma also we tried by this magotification treatment. And this is also recurrent case of oral carcinoma we treated. This is called megatic debridement therapy, nowadays very popular in Western countries. And recently we have taken extramural project like randomized clinical study to evaluate the effect of WHO gel versus povidone iodine ointment in the management of Dushtavarana with a special reference to non-healing wound, and it's very wonderful results with the WHO gel. It contains Grutakumari, turmeric, Karanja oil, Gogruta, Madhu. These are the drugs we conducted in two groups, group A and group B, with encouraging results with the WHO gel. A natural wound dressing ointment we can use in all types of infective and non-healing wounds. These are the some of the photographs before and during and after treatment of WHO gel. Thank you.